This is basically where I started back in 2001. When I first started seeing the patients I was seeing on the wards, coming out of medical school, I thought, this has got something, this is rubella or German measles. Well, this is the work that came out of that, partly related to the manuscript submitted to the College of Physicians and Surgeons of Ontario. So for a few years I thought I was just chasing German measles, but it just didn't stack up to the evidence, going back and forth to the patients, back and forth to medical literature, back and forth to multiple libraries, getting multiple articles, trying to put the whole puzzle together. I spent more of my time learning in these areas that I didn't learn in medical school, that I realized it covered multiple different areas of knowledge that I had to go learn to try to make sense and figure out what's going on here. But by doing so, and taking the time to do that, with the background training and years of education that I had in the brain and behavior areas, now armed with the ability to go seek out the medical literature and self-teach as you're going along and problem solve and make predictions of what has to be true and not true to fit what you're seeing before you have that knowledge. And when that happens to you a couple hundred times, that you actually can advance predict that our knowledge in this area of medicine cannot be correct because it doesn't fit with this clinical data. And you do that repetitively, it's kind of like building a bridge with each piece of knowledge you get. And eventually these two posts, you see this post lines up with that post, and autism and stroke, and all these pieces in between have to be fitted together. And this is kind of an analogy to the autism puzzle piece that we're all trying to figure out. And eventually this bridge was built, and the answers are in zeta and blood sludging, which we've called mass. And initially I thought I was chasing German measles. However, it turned out not to be so. This is one of the first cases I saw. This is a young child being held by her mother. You look at the corners of the cheeks of this young girl. She has the classic sort of features there of a childhood disease. In this case, it has a lot to look like rubella does that. German measles does do that. In fact, she was found this was German measles, or looked like German measles. And the mother was pregnant at this time. So unfortunately, rubella, or German measles, will cross the placenta and infect an unborn child, even if the mother, however, the unborn fetus can be adversely affected. And in this case, this was another example of several other I come across where here I had a mother who was pregnant, who was exposed to German measles during the time of her first trimester pregnancy, and ended up giving birth to a child who was later diagnosed with autism. And this again, the slide here as well, also showing this young girl here as well. Her name is Baby C. She's on the outside slide and the inside slide. And in the middle part slide, you see another girl who also has rubella on the corner of her cheek. And this is a child who comes from the dockets of the Centers for Disease Control. And you see the similarities between Baby C and the classic features here. And this now actually puts it together, and the final result is that, because the young boy at the bottom part here, wearing the black t-shirt and the baseball cap, that's Norman. And he was actually in his mother's womb when she was exposed to German measles during her first trimester of pregnancy, and he developed autism early in his life. But the interesting thing about Norman is that here he is here again, the slides on the slide of Norman as an adult. The slides from younger years are not actually him. Norman had what we call in medicine a transcortical motor aphasia. Fancy words meaning he had impairments with his language. He could not speak to some degrees. He could repeat things being said to him in simple forms, but he could not produce any meaningful speech, no fluent, productive speech. And he had the ability to comprehend. Intact comprehension, intact repetition to a varying degree, no speech output. You can only create that behavioral syndrome in the human brain by damaging the small blood vessels. And we realize that is because the areas for speech production are in what we call watershed areas of the brain. And watershed is a critical term to understand here, because watersheds are in all body parts. Watersheds are areas of blood supply to an area of tissue where you have two different main blood vessels coming in the area to provide oxygen and blood flow to that area. But the watershed areas are the areas between those vascular territories, so that if you block off blood flow to one of the blood vessels, that the whole watershed area is an area most likely to be damaged because it doesn't have collateral circulation coming in to that same area to pick up the slack. So watersheds are critical to blood flow. They're most susceptible to decreased blood flow. And the damages you see, like a transcortical motor aphasia in a young boy like Norman, who had this history of this prenatal exposure to rubella, was very interesting to me, because you have to ask yourself a question as an inquisitive physician. How does a child at 1.5, 2 years of age give the behavioral profile of someone who has had a stroke? And that's where my work started back in 2001 with a bunch of cases like this, because the neurological and neurobehavioral profiles I've seen could only be accounted for by strokes based on the knowledge of the watershed vascular territories of the brain and the functions that they control.